So this is the radial pressure device. There's two different types of shockwave. EPAT is another term, extracorporeal shockwave therapy. It's all using acoustic therapy, acoustic sound waves to go into the tissue to disrupt the tissue. This is vibration. It's similar to Theragun, but it's not percussive. So when we talk about percussion, it's really an in and out. This is vibration. When would this be used? I like to use it right before a treatment, especially if I have a patient who's in a lot of pain. I'll hand it to the patient and I'll say to the patient, hey, why don't you go ahead and warm up the tissue a little bit. And I like it because if you watch where the patient goes, it'll kind of guide you where you need to be going. It's also good after a treatment. If you really beat them up, so to speak, we know that vibration can cause some sensitivity or desensitization, so it can be helpful therapeutically that way. One thing to keep in mind with either of these setups, there's two buttons on your left-hand corner, left-hand side. One looks like this, one looks like this. To engage that mode, you click on it, then you turn, once you get the settings where you want, you push the power, you hear the compressor turn on. You do your treatment. When you are done, if you just hit home and come out and try to go into the next screen, you'll have errors. It won't let you. You have to end the session. So you'll see it'll say stop, and then it'll say exit. So this is called the V actor for vibration. This is called the D actor. I don't know what the D stands for, but that's basically your shockwave.
Comfort mode is on, yeah. So you're right at 1 bar now. It's gonna go up to 2.9.
Okay.
You can tolerate it. We'll just use the presets as is. Ultimately, it's patient feedback.
Dr. Brady didn't give me any.
Awesome, thank you.
Now this is what I was talking about as far as just shaking a slight angle,
Gotcha.
just to see where he's telling you you're in the right spot. You know what I mean? That slight little angle.
Oh, like, just every time you move it, just create a different one?
Well, not going to create every time. You're looking for him to tell you where the right spot is. And if he's like all of it, then you want to scan all the way around. But there should be a spot where he's like, oh, that's the spot right there. You want to hang out there.
Okay.
Have you had a single spot that's been?
So kind of like a top.
Yeah.
How about now?
About a 5.
So we can max this out, and then if he's like, I still need a little bit more, that's when you go to the goal. Remember, when you go to the goal,
Right here?
Yeah, that's like.
what's the intensity?
Probably like a 6.
Okay. So let's say he was still at a 2. I would pause it, and I would go to the goal.